You get this after me, in case she needs it for her computer.
Oh, okay.
So don't go too far. Hi, everyone. We're going to get started. We're welcoming Jennalee Lundquist today from Door County Medical Center. She's going to talk about Senior Life Solutions. We have a few announcements, just reminder things. On your table is a little survey. We love your feedback. So if you can fill that out at the end of the program, you can just leave them on your table and we'll pick them up. The other pretty colored yellow-green, very Packer-themed thing on your table, was that Roxanne, is a survey from our friends at the Aging Disability Resource Center. They do their aging plan every 3 years, and they're just seeking your inputs. If you want to fill these out, we will get those to them as well. Those are also on your table. Up here we have some COVID tests. If you need them, please help yourself. The 911 cards, the ADRC newsletter. We have some things coming up. I'm going to let Bunny talk about that. Did I miss anything? Did I hit it? It's awfully quick. Just a reminder, 911 cards, and if you're interested in learning more about DNR, we have that information up here too. So,
Do not resuscitate.
great, which means do not resuscitate. Sorry, guess I should clarify that. So, I'm going to give this to Bunny. Hold on. You click that. You put on your name tag. There you go.
Oh, God.
That'll be the easiest.
Okay.
All right.
All right. Just when I've got it all down pat, they change the system. Okay. So, just a couple of announcements. First of all, welcome. It's good to see all of you, and hope you enjoyed lunch. I'm sure you did because it's awesome. Okay, and remember, after everything is done, I'm sure there will be some to-go boxes on your way out to grab some food. Please do. All right, so our next event is the May 16th luncheon, and that will be Sierra Witchdeck. Okay, from the dementia care specialist, and her topic is going to be Dementia 101. So that will be in May. That's May 16th. Also, I'm trying to figure out a date for the next Coffee, Cookies, and Conversation. And those of you that have been there, did we have a good time? Yeah. I'll tell you, it's just getting to be really fun. We had such a diverse group, and we kind of start out all talking together, and then all of a sudden they break off into groups, and it's free. It's coffee and treats, currently made by that handsome gentleman over there that that I can finally call my husband. Anyway, but he's awesome. So you got to try that. I'm not quite sure about the May date, but it is always a Wednesday, and it's from 10 to 12 in the Mosling Room at the Rec Center. So just watch for posters, and then I can email you too. Okay, June 7th is the end of school picnic with the school that is open to the public. We do that with the school. We do all the cooking, and it's at the Red Barn. And you can bring a dish to pass if you like, or just come and eat and mingle with the students. It's really a cool thing. And then on the 7th, June 7th, it's a Friday.
I thought their last day of school was on the 6th.
Oh.
I'm investigating while you're.
Okay, please do. Okay, it might be the 6th. Okay, then on June 21st, we have our annual open house. And what that is we partner with all kinds of organizations throughout the county. And they come up here, and we have tables set up, and they tell you about what services they offer to us and for us. It's really, really a good thing to come to, because there's so much that is out there to help us stay here in a healthy manner as long as we can. Okay, having said all that, our speaker. Oh,
sorry.
Okay.
Going to the open house.
She's getting open house.
Okay, and I'll give you this, and I'll give you this. It's kind of cute.
Okay. Everyone hear me? Perfect. No? I'll talk louder. I can talk louder.
When you bring the speaker over, bring the speaker over for Wally.
I can go sit right at that table too. I'm gonna stand here just so I can see my papers while I am talking. But my name's Jennalee Lundquist, like they had said earlier. I know that Christine had posted my bio for you guys to look at. Any questions about me before I start after reading my bio? Nothing? All right. Well, I am somewhat a native to Door County, somewhat. I grew up in Casco, so I know the area very well. I currently live in Kewaunee. Like I said in my bio, I'm not related to any Lundquist up here. My husband's dad was born in the state of Alaska, not the little town of Alaska on your way to Kewaunee, but the state of Alaska. So no connection up here. But my maiden name is Famry, which is very common in the Casco area. All right, so I am the program director at Senior Life Solutions at Door County Medical Center, and we will talk about that today. So thank you, each of you, for joining me today for this presentation. Today I'm here to talk to you about our program and the services that we provide. We will discuss older adult mental health, what services we provide, who would benefit from our program, and the referral process for our program. So let's get started with a program introduction. So what is our program? We are an outpatient group therapy program at the hospital designed to meet the unique needs of older adults experiencing depression, anxiety, and or other mental health challenges often associated with aging. And I'm going to interject a little blurb into the presentation so that you all understand. We do offer 100% remote services. So a lot of people don't know that about us, or kind of, check out when they don't think it's going to apply to them, but we offer 100% remote. I've come up to the island actually, to people's homes to do intakes for our program, and we have had patients that have never stepped foot into our department at the hospital. So it is a great opportunity and a great asset that we do 100% remote. So meeting our team. So we have Dr. Nina Jordania, she's the medical director. I have a little bio blurb on her on the next slide. I also have her little bio down over there if you want to take one. But she's our medical director, and she's also the psychiatrist that our patients see. She lives in Florida, but she sees everyone via Zoom. So it kind of works nicely that the patients, they can either come to Senior Life Solutions and go on the Zoom call there with Dr. Jordania, or they can do it from their home too. Then the program director, that's me. So I am the program director. I'm responsible for directing and coordinating the activities of the program staff to ensure quality patient care and providing community education to create awareness of the program. A lot of what I do is going around and doing speeches or presentations like this. I also present on all different things like sleep hygiene. I'm going to a caregiver support group to do mental health bingo. So I just really try to integrate into the community. I went to a Rotary meeting on Tuesday to do a presentation. Wednesday I presented at the Sister Bay Clinic Wellness Day. And today I'm here, so my week has been very busy. And then I'm also the program nurse. So I'm a registered nurse as well. So I'm responsible for providing nursing oversight to the patients, and I coordinate with Dr. Jordania and other staff members regarding our patients' care. The therapist, her name is Beth Ziolkowski. She is somewhat of a local too. She lives up here now, but she grew up in Manitowoc, so she knows the area very well. And she provides therapeutic services for patients. She leads group therapy. She does individual sessions with the patients. She can do family sessions. She can do couples sessions, but she is the therapist, the leader of all of those sessions and all of those groups. And then the office patient coordinator, her name is Christina Blackley. She has grown up in Sturgeon Bay and lived in this area her whole life. She is our front desk person, the face when you walk into our department at the hospital. If you call us, she's going to be the one answering the phone. She does all of our billing. She does a lot of our clerical stuff that I need her to do. She's kind of my right-hand person. And she also really connects with a lot of the patients. We had a patient at Valentine's Day that forgot to get his wife a gift and didn't realize it was Valentine's Day until he came to group and we had Valentine's treats. So she actually walked him down to the gift shop at the hospital so he could get her a gift and bring it home so it didn't look like he truly forgot. So she just really gets to know the patients on more of a personal level and really goes out of her way to make sure that they're being taken care of. Our entire team is dedicated to providing excellent care to the older adults in the community to improve the quality of life for them and those around them. So this is Dr. Jordania. A lot of people don't know what she looks like because she only does visits via Zoom. And actually on my team, between me, Beth, Christina, I'm the only one that has seen her because I sit in on those Zoom sessions. Beth doesn't and Christina doesn't, so they have not seen her either. But she sees all of our patients. She also sees patients at other programs, Senior Life Solutions programs. So our patients will always see her. It's not like you're going to get a different psychiatrist each time. She will be your sole psychiatrist when patients go through our program. She is great. I really, really like her. She's very easy to work with. She really tries to get to know all of the patients. She has an accent, so she's a little hard to understand, but I usually am the interpreter during the sessions because she's from the country of Georgia. It's a little bit of an accent. But yeah, that is Dr. Jordania. And she can prescribe meds. She can prescribe labs. She is really involved in the treatment planning as well. And one of the benefits of our program is we usually can get you sitting in front of Dr. Jordania within 14 days. So we do Doctor Day every 2 weeks. So she is on our schedule every 2 weeks. So that is a very rare oddity in the psychiatric world. Usually it's like 6 months or more. You have to wait to see a psychiatrist and we can have you see her within 14 days. Now that you know a bit more about our program and team, I want to discuss older adult mental health and the challenges they may face that could affect their mental health. Often mental health challenges are onset by a major life change, causing a person to feel sadness, guilt, hopelessness, or worthlessness. Common older adult life transitions include retirement. That is a huge one that I see in our program, where people are retired and then they think, well, this is great, I can do all of these things, and then they don't know where to start or don't know what to do, or feel like they don't have a sense of purpose or worth anymore because they're not working, and that might cause them to seclude and isolate in their home.
Have them come to the island, they'll get volunteers.
I can, yeah, yes. Kids growing older, having their own families, so kids that were living in your home now moving away. Limits to physical abilities, maybe living arrangement changes, like going from a large house to a smaller apartment, or a house to an assisted living, something of that nature. Losing loved ones, that's also a really big one that I see come through our program, where people that have been married for 60 years or more, lose their spouse and they just don't know where to go from there or what to do. Loss of independence. As we grow older, we experience more of these life transitions, and often they can be painful and more difficult. So as we compare older adulthood to the previous chapter in our lives, many of the changes that occur in our lifetime early on are changes that we initiate ourselves, that we intended to happen. But More of the life changes later in life are more involuntary and not things that people necessarily chose to happen. So it can cause older adults to feel a loss of control and feel that life is happening to them rather than they're experiencing life. And if you have questions during, please let me know. Did it click? No. So another challenge older adults face when it comes to mental health is the stigma surrounding it and getting help. So especially this generation, it is very kind of a taboo subject, a taboo topic that people don't want to talk about or don't know how to talk about it or where to go. So the things that you should know, it's important to know that mental health is just as important as physical health. Mental health challenges are not a sign of weakness, and often they are out of the person's control. Additionally, there's a stigma placed on seeking mental health treatment, and that can be related to the stigma surrounding mental health, but often because people are just unsure of the resources or unsure of where to go or how to start. So in addition to providing mental health support to our patients, our team provides education to community members and clinicians on the importance of mental health in an effort to break down those stigmas and encourage those who need it to seek help. These are some statistics on unmet needs of older adults. So 33% of older adults become depressed after losing a spouse. 50% remain depressed a year later. 58% believe it's normal to get depressed as they age. I hear that actually quite a bit, a lot more than you would think. It is not normal to become depressed as you age. And 68% know little to nothing about depression. So if you don't treat depression, it can cascade and lead to a lot of different health issues. And the people that said, well, this is normal, it's just part of the aging process. I do a lot of blood pressure clinics in the Door County area, and one of the things that I usually give people is the check your mood, which I have flyers over there. It just kind of goes through different symptoms you might be having if you're depressed. And I've had people look at it and say like, oh yeah, a lot of those apply to me, but I'm just getting older, so that's why. And it's just not true, and I tell those patients or those people that you don't need to be okay with that. Like, there is help, there's hope. You don't have to just be, well, it's okay, I'm older. It's not the end. Some consequences of untreated depression: you could have cognitive decline, confusion, decreased attention or concentration. I see that a lot in our program as well. Heart disease, med noncompliance. If people are depressed, they don't want to get up, they don't want to take their meds. They might not have the motivation to take their meds, and that obviously can cascade into a lot of other things. Poor nutrition, risk of infection, stress suppresses your immune system. There's also increased risk of suicide when depression goes untreated. According to the Suicide Prevention Resource Center, suicide rates are actually the highest in older adults. 40% of suicide victims are over the age of 60. After 75, the rate is 3 times higher than average. And among white men over 80, the rate of suicide is 6 times higher than average. And I actually kind of researched Door County and the statistics of this to see where Door County lands. So as far as mental health providers for Door County, there is 1 mental health provider for every 740 residents. Wisconsin's average is 1 for 420. So we are at 1 for 740. The United States average is 1 for every 340. So we definitely do not have the right amount of resources. We are in a under-resourced population for behavioral health. And then for Door County suicide rate, I did research that as well. It is 20 per 100,000 individuals, and the US average is 14 for every 100,000 individuals. So we are higher than average. So it is a real thing in the community. Depression comes in all shapes and sizes. We know that depression looks different in all ages, but today we're going to talk through what it might look like in older adults. So in older adults, symptoms might include changes in appetite or weight. I see that quite a bit, usually loss of weight, but it could be a gain where people are stress eating or comfort eating, but a lot of times people don't have the motivation or appetite to eat. Change in sleeping patterns, I see that a lot as well, where they can't fall asleep because their mind is racing, or maybe they wake up in the middle of the night and then can't fall back to sleep because they're still thinking of things that happened during the day or what they have to do the next day. Decreased interest or pleasure in things previously enjoyed, depressed or sad mood, increased sleep or insomnia, lack of energy, low self-esteem, difficulty concentrating, unexplained aches and pains can also be included. Some of the symptoms I just listed are often thought to be a normal part of aging. I am here to tell you that is not true. There are too many older adults suffering from untreated depression right now because they think that their suffering is a normal milestone. No one should accept these symptoms as a normal part of their older adulthood, and we're here to reach those people, support those people, and treat those people. So what can our program do to help? As we discussed, many of the life changes that accompany aging often turn into an extremely stressful part of one's life, filled with new health diagnoses and continued losses of independence. These changes can sometimes lead to depression, anxiety, and even suicidal ideation. But don't worry, we're here to help. We're going to discuss the services and support that we can provide. The support from our program. Our services begin with a confidential, comprehensive assessment to help determine if that patient would benefit from our program. So if I get a referral, I will call that patient, explain the program to them, and then ask them if they think they would benefit from the program. Our program is completely voluntary. If people do not want to be there, they do not have to be there. If they say, yep, I would love to join your program, I think that it is going to help me, then the next step is that I meet with that patient and I go through a bunch of assessments with them. We do mini mental to make sure cognitively they would gain from our program or be able to provide input during our program. I do geriatric depression scales, Zung's, Cortens, health history, psych history. It's a pretty intensive meeting. It takes a little bit over an hour. And then after that meeting, I as a nurse determine, yes, I think they would benefit, or no, they don't qualify. And it's kind of a team collaboration too. I talk to the other people on the team. And then once I feel or we feel, yep, they would benefit from our program, then we schedule them with Dr. Jordania. And she asks a bunch more questions and dives more deep into what is going on, and then she gives us the actual order for that patient to join the program. So we don't need a doctor's order for someone to join our program. We actually get that from our psychiatrist. So you can self-refer. I get a lot of referrals from the ADRC or people out in the community, but we don't actually need a physician's order to start the process. During the program, we do group, individual, and family therapy, med education and management, aftercare planning. We check their vitals each group day. We ask them questions each group day of how is your sleep, any changes in meds, any side effects. We do a little mini nursing assessment each group day too. So this leads me into group therapy. So group therapy seems to be one of the biggest hiccups that I get with people joining our program. A lot of people say, I don't want group therapy. I don't want people to know what's going on with me. They don't want to air their dirty laundry, so to say. But that is not what group therapy is. So I really try to educate on what exactly group therapy is for our patients. We are an intensive outpatient group therapy program, so our patients do go to group 3 days a week. It's Monday, Wednesday, and Friday, and it's from 9 to noon. They get 15-minute breaks at each hour, but during group, the therapist is like giving them tools. She might show a TED Talk, or she might do a project with them, and then she talks to the group as a whole to see how they as a whole feel that they could use what they learned in their lives. And she does go around to each person to ask individually, but you never have to say your history, you never have to say what is going on in your life unless you want to. Everyone has the right to pass, so you don't even have to answer the questions. I have the group rules over there as well. Everything is confidential. Every patient signs a confidentiality agreement. All of the staff, we are confidential as well. So if I see anyone out in the community or even at events like this, I cannot say, well, oh, Mary, so good you're here. I'm glad you were in group the other day. Thank you for coming to my talk. I can't say anything like that. So I always tell my patients, if you see me out in the community and I don't say hi, it's not because I don't like you. I can't approach you first. You can approach me, but I cannot approach you. And I have had it happen where I do presentations and people in the audience, I know that they were in the program. One time I didn't know because they were in the program before me, and they actually voluntarily raised their hand and said how much the program had helped them. And they can do that voluntarily, but I can't ask, like, oh, tell me your story. Tell everyone how group worked for you. I can't even use anonymous testimonials, which I wish I could, but I can't. So it's very, very confidential. So with group therapy, I asked the therapist at the program once, like, how can I explain this to people so they actually understand? So she explained it to me, like, if you think of working out, like at the Y. So when you are at the Y working out with everyone else, it's motivational. It drives you to work out. You're all doing the same thing. You're working towards the same goal. But you don't know everyone's story that's working out in that gym with you. You don't know what's going on with them, but it still provides that motivational aspect. Now, if you wanted to, you could meet with a personal trainer. In our case, it would be our therapist. That personal trainer will dive more deep into your story, and they will know your history. So our patients do meet with our therapist one-on-one twice a month, and that is where they dive into that past and specific problems that are going on with that patient. So it's that dual therapy that really benefits the patients. And once she said that to me, it like clicked, so I use that every time I'm talking, because people don't understand group therapy, and I really want people to understand how beneficial it actually is to know other people are going through the same things or similar things, and you're all working together to get to a common goal or a common end. How people benefit from our programs: they experience a reduction of symptoms of depression, anxiety, other mental health challenges. I do like a little tracker where I track people's admission depression scores and their discharge depression scores. There is always improvement, always. Last month I had 100% of people that discharged from the program that were at a normal depression level or below normal when they discharge. So we always try to get them to that normal level, but there is always improvement from admission to discharge. Unless they involuntarily discharged, like if they had a life event like a surgery or something like that, obviously that would play a little bit differently than someone who graduated from our program. And we do those scales monthly with our patients. So we do testing monthly to see where they're at with depression, anxiety, all of those things, and then we taper their therapy based on those scores. So now that you understand the support we provide and the benefit it brings, we'll talk about who our services would benefit. As I've mentioned, our program is designed for older adults, typically 65 or over, who may be experiencing depression, anxiety, or other mental health challenges often associated with aging. The 65, it's kind of a somewhat set in stone rule. If a patient is Medicare eligible and less than 65, they could join our program. But just with the population, the age group of our program, it is better to keep it over that 65. I did recently have someone want to join that was 64, and I begged and asked my higher-ups, can she join, and they said she can't, she wasn't Medicare eligible. But I did ask her, do you want me to call you when you turn 65, not on your birth date, but a little bit later? And she said yes, so I have her on my calendar to call once she turns 65 to come to our program. Yes?
So only people on Medicare can do this?
Yes, our program, if people have straight Medicare and a supplement, then it is usually covered 100%. It is a Medicare-driven program. Yes.
So that excludes private pay insurances?
You can do private pay insurances. It's usually not covered, and it's very high cost to do private pay, and then it would have to go through the hospital, and they'd have to set up a payment plan and all of that beforehand. So that's why the program is geared toward people 65 and over, because it's a Medicare-generated or Medicare-geared program. Yeah. There is a behavioral health department at the hospital that does treat people younger than 65, but our program specifically is for people over 65.
I think that's kind of limiting, because there are a lot of people over 65 that continue to work and have private insurance, and there's a huge waiting list for the behavioral health program, whether here or there's not. I would hope that that would be something that they would talk about, seeing what they can do about that.
I know that there has been talk about that. It's at a very higher up level than me. But I know that there has been discussion, and a lot of us program directors, we kind of get together to talk, and that has been one of the common talks of our discussions of how many more people we could get into the program if we didn't just limit it to straight Medicare patients. Yes?
Somebody doesn't qualify for your program, I'm assuming that you then take the next step and help them find something else.
Absolutely, yes, good question. So if someone doesn't qualify, I don't just say, oh, I'm sorry, you don't qualify, I'll see you later, good luck on your journey. No, I always have to set them up or help them get the resources that they need depending on their situation. So the mental health focus group of Door County has a great resource guide that I use a lot for the patients that might not qualify for our program. If it is an insurance issue, I do know a couple of therapists in Door County that kind of do their own private practice, not through insurance, and have really good rates, so I will refer them to her or those people. Or it depends on why they're looking to join the program. I've had people that weren't eligible or didn't want to join that were struggling with their loved one that was having alcohol issues. So then I looked in that mental health focus group guide to find specific groups and specific resources for people struggling with family with alcohol abuse. And I give them all of those resources, yes. Yeah, good question. Any other questions? Yeah?
What about people who are over 65 but have chronic psychosis, psychiatric diagnosis, but are well managed? Are they something that, in our experiencing some of these other issues, are they eligible?
Yeah, as long as the chronic psychosis is well managed, like you said, yes, absolutely. Absolutely, they could join our program.
And if they go off track and have a break, you are able then to help them get into the services that they need?
Yes.
And what is available for that?
We do have a crisis program in the emergency room.
Okay.
It's actually funded by our company as well, but it's more for crisis situations. And they will set up with a psychiatrist virtually that can see that patient in that crisis situation, and then they can follow up as well with that psychiatrist. Because, like I said, the behavioral health clinic is so backed up. Yeah, so we have that to offer. And I can always make referrals too, not even just to other psychiatric areas. I have referred like care management to some of our patients where I feel like they're not gathering what's happening at their doctor's appointments. I feel like there might be some med management that's not going correct. I think they could really benefit from having someone at their appointments with them, hearing what the doctor is saying. They might see a lot of different doctors. So I have referred care management, patients to care management, and that has been very helpful. Even I had someone, I went into her home to see if she was eligible for our program. She was not, but I did question, should she be living alone, and is she taking her meds correctly? I really didn't think that she was. I actually had her show me, her pill bottles and all of that. And I just did not feel comfortable just leaving and not doing anything. So I reached out to actually Sierra, who you talked about earlier, the dementia specialist at the ADRC, to say, hey, what can I do to help this person? Like, can you do a screening? Can you help her? She hooked me up with Christy, was Nikki at the hospital, yeah. And she then told me to get a referral from the doctor, so I reached out to the PCP to get a referral, and we were able to get that person help. So I always go above, beyond. I really try to get the patients as much help as I can. Yeah. Good question. Yeah.
You have a very comprehensive program.
Yeah.
And it's also, I see, very time consuming for a person. I mean, they really have to be committed to it. What if they don't want to do the group therapy? Can they choose not to and just speak to a counselor and maybe the psychiatrist, or?
You can. It's harder to do, and it would only be short term. So a lot of people say, I don't know about group therapy, but I'd like to meet your therapist and meet with them a few times to kind of see if I'm comfortable. That is possible, but it would be short term. It would not be long term, because our program is based on group therapy. And you said it is time consuming. The 3 days a week, they don't have to start at 3 days a week. We recommend that. You could do 2 days a week if you wanted, or 1 day a week, but the 3 days is what is recommended for the best benefit. And you're not on the 3 days a week forever. So we meet every 2 weeks to look at people's progress and if they've reached goals through our program. And if we decide as a team, they've reached certain milestones, I think they can taper down, then they will go down to 2 days a week, and then 1 day a week, and then graduate. And the amount of time in the program depends on that person's journey too. It's all individualized. So some people have been in the program over a year. Some people it's 3 months. Some people it's 6 months. It just depends on the progress that they make. And then they can always come back to the program if they want to. We actually just had 2 referrals, 2 past patients this week call us to see if they could come back to the program. We do aftercare social events quarterly, where we have all of the patients that have graduated from our program come and just kind of socialize, talk about their successes, how things are going, kind of, have you experienced this? I've experienced this. How did you handle that? Kind of to help each other and build up on each other. And then we always meet with them to see how they're doing individually instead of how they presented at the group, just to make sure that they might not need more services. And those parties are always kind of fun. I had a guest speaker come in from the Y the last time to talk about volunteer opportunities, and they really liked that. It was National Volunteer Month in April, so she came to talk about that. Any other questions? Yeah? Yeah. Either one.
If I remember correctly, I think you listed memory problems among those symptoms
Mm-hmm.
which are incorrectly associated with aging. Could you expand on that a little bit? I want to know
So-
if I can't use that as an excuse anymore.
As it is. I mean, I don't want to say wrong things because I know more of the depression, mental health side of it. But memory, it's not normal. Like, not every old person gets dementia, or not every aging person gets dementia. The memory problems, they could be happening from an imbalance of chemicals in your body. They could be happening from thyroid issues, depression. It's not normal. You need to figure out the actual cause or the actual reason that you are having those issues. It's not just because you're getting older. It is because of something. Something is happening. So really investigating that sole reason as to why it's happening, that explains, if that answers your question. Does it answer your question?
I'll try and remember that.
Okay. Yes, thanks. Yes,
And are the group sessions, you said you're 100%, they're remote,
it can be.
so someone could be in their home
Yep,
on Zoom and,
yes, yeah. If you do remote, we just ask that no one else be in the room with you. So you need to be in a secure location with no other people. And we set you up with the Zoom link and all of that, but it is 100, you can do it 100% virtual. Some people come to our center though, so the people that are virtual can see the people at the tables at the center and the therapist, and then they can see the virtual people as well. So you need to have your camera turned on. Because the therapist has to document the times that you're in group. So if you get up to go to the bathroom during group, she actually has to document that, like as missed group time. So when you're at home, we ask that you treat it as if you were in group. So no drinking alcohol or smoking tobacco or sleeping or anything like that. You really need to be just like you were if you were in group participating with everyone else.
and how is physical activity incorporated into the group session?
We do nursing educational groups, and a lot of those fall on exercise and how exercise can help your mental health. One of the ones we just had recently was chair exercises and how important that is, how it's all connected to your mental health. And then we have people like from the Y, I've had guest speakers come in to talk about physical activity and mental health.
I mean, during that, 3 hours?
Yeah.
Is there ongoing, do the participants do physical activity at all?
No, except during those nursing education groups.
Okay.
But during the 3-hour sessions, no. They get the 15-minute breaks and they can walk. A lot of that, we have a puzzle table. People do puzzles and stuff like that. But there's not a formal like exercise during the program, no. Any other questions? Okay, let me see where I'm at. I might have explained everything else, so we might be good. So that is the number to our program and my email. I also have cards over there. I have literature on our program over there if anyone wants to grab any of that. And then we do have a monthly newsletter that talks about how different medical aspects tie back into mental health. Like February was cardiac month, so heart health and how that ties to mental health, sleep hygiene. So if you want to sign up for a monthly newsletters, that is over there. We do have an open house coming up in May. Can't remember the exact date, but it's over here. May 23rd. So if you wanted to grab a flyer for that, you can. Yeah. I think that's it. Unless you guys have more questions, I'm an open book. I'll try to answer them. Thanks for giving me a mind-stumping question, because now I'm gonna take note of that in case I get asked it again, because it happens. One time I got asked what the therapist, all of her acronyms after her name meant. I was like, oh, I said, I don't know. So I had to look them all up, because I'm a nurse, I'm not a therapist. I don't know what all the little things mean. So then I asked her, I'm like, Beth, you have to write this down for me. So she took her cards and she wrote them all on there for me. I'm like, thank you, because I got asked, what do they all mean?
Now, you said you are coming back for our
Yeah.
open house.
Yep, I will be here for open house as well.
So this is a good reason that if you have a question that you're not asking today, or if you think of one,
Yeah.
come to the open house and you can ask them.
Or you could email me too, but yeah, I will be at open house. So if anything crosses your mind, please come and visit me. Or just come talk to me. I'm open to just talking about anything. Anything else? Yeah. Yeah. I hope I didn't miss anything. Yeah, yes, yes. All right, well, thank you guys. Thanks for bearing through with me.
Okay, the drawing for the $25 gift certificate for Jack Nervous Soup. Let's see. Who wants to draw it?
And it's okay if you draw your own. It has happened.
Yes, it has.
Oh, yeah. I'm in a Hyundai all the time.
We got two there, so we can drop one in before you see.
That's good, Jerry. There we go.
Oh,